Okay. Hi again. I'm Mary Catherine Beach, Professor of Medicine and Director of the Scholarly Concentrations Program. Today I'm going to be talking about what types of projects students do in the course. So, when I last talked to you, we were at the stage of choosing a concentration and learning about it and then thinking about what your interests might be. We're now getting to the point where it's time to identify a mentor and a specific research project. So while you're thinking about what you would want to work on and who you would want to work with, it's sometimes helpful to look at what other people have done to get ideas. So I'm going to describe to you now what some of our students have done in the various concentrations. So first, think about what you're excited about and how you would want to spend your summer, because this project can take a lot of time and you want it to be something that you enjoy working on so that it gives you energy instead of takes energy away from you. You want it to be something that makes you more excited to be becoming a physician and less overwhelmed. And because it takes time, it's something you're going to be doing a lot and you want to enjoy it. So first, if you're in the basic science concentration, you have a variety of projects that you could choose from. But in general, in this concentration, these types of projects tend to be recommended to you by your faculty mentor. So a lot of times, students would not necessarily come prepared to develop a hypothesis related to a basic science topic because you don't have enough experience possibly to do so, but you would be working with a mentor who might make some suggestions to you. Still, I'll give you a sense of what some of our students have done so you can think more deeply about what you like. So when we talk about basic or translational science, the term that we use is often bench to bedside. And sometimes we say bench to bedside and back again to the bench. And so what that means is that we might discover something in a laboratory and then want to figure out whether it makes a difference in humans. And so the early stages of that research is called the bench to bedside part. And then there are times where we discover a patient who has an interesting presentation of a particular disease, where we might want to take patients who have that very interesting and unique presentation and take some of their cells and figure out whether there's something in common about those patients. And that's where we get the bench to bedside and back again to the bench. So some of the questions that our students have addressed are, can we detect subclinical head injuries? What role does inflammation play in type 1 diabetes? Can we study yeast metabolic pathways to uncover potential drug targets for Parkinson's disease? What types of microcapsules work best for chemotherapy delivery? Or can we define a pain pathway in cancer patients with bone metastases? Why does bone metastases cause pain? Some of the projects that students have done previously in a little more detail. Here's an example of a project done by one of our students who looked at the assessment of repetitive mild traumatic brain injury by retinal imaging with optical coherence tomography. So in the background, acute and repetitive mild traumatic brain injury is difficult to diagnose, and yet repetitive mild traumatic brain injury is linked to poor outcomes. So there's some question about how we can figure out how to diagnose that condition. And so his hypothesis was that the thickness of the retinal layers would change after these multiple injuries. And his goal was to apply a non-invasive portable imaging modality to make that diagnosis. And his results were that he established the feasibility of scanning and mapping mouse retinal layers for this purpose. Another of our students looked at the synergy between immune cells in a cohort of elite suppressors and whether it inhibits HIV replication. So the background of this was that some patients who were infected with HIV never progressed to AIDS, presumably because these patients naturally suppress HIV replication, but no single immune cell type appears to be responsible. So her hypothesis was that cooperative activity among immune cell types confers the elite suppressor phenotype. Her goal was to measure HIV replication suppression under a variety of conditions and multiple immune cell type combinations. And she found her results that certain combinations perform significantly better than others, plus and she developed a substantial protocol that enabled her collaborators to take this research and move it forward. So she had a great experience also with some preliminary results and then a promising protocol that moved forward after she finished the course. In the clinical research concentration, different types of studies can be done. Many of these are recommended by a faculty mentor who may already have a project in the field, but these are the types of projects that students may sometimes think of doing themselves based on your own previous experience or interests. So, what is clinical research? It's a collection of evidence that enhances our understanding of disease in humans or the prevalence, prevention, diagnosis, and treatment of disease. It usually involves a particular person, group of people, or clinical samples from an individual or group of people. It can be observational or interventional, and it can determine safety and efficacy of medications or treatment interventions intended for human use. Typically, what your life looks like when you're doing a clinical research protocol is you might be involved in a medical record data abstraction project where you take all the patients who have a certain type of condition and you look in their medical records to pull out some clinical parameters and then figure out whether you can describe something new about that condition based on what you've found already in the medical records. Now, that's a very good type of project for medical students to do because you have the expertise to do it, and you can collect your own data that are of interest to you. And you don't necessarily need some advanced statistical methodology to do that kind of work. You could also engage in a secondary analysis of an existing data set. What that means is that somebody else already did a study, they collected the data, they put it in a data set, and maybe they collected the data to see whether treatment impacts a disease. And so they did a randomized trial, and they found that the treatment does impact the disease, and now they have all the data sitting in a data set, and there are what we call secondary questions, like it wasn't the primary reason why the research was done in the first place, but because the data exists, there you are able to say, okay, I'm very interested in this disease, and even though we've already answered that primary question, this researcher collected a whole bunch of information that will be useful to me when I could analyze and find out something different about the disease. Some other students have surveyed a group of patients in a clinical setting that would answer a clinical hypothesis. Some have looked at biomarker analyses of blood samples from existing study populations, which, just like I've said in the orientation to the course, the concentrations are not completely distinct. So a biomarker analysis could go in the basic science concentration, but it could also be in clinical research, and it doesn't really matter. And then another type of research that's really good for medical students to do is a systematic review of a clinical research area potentially using a meta-analysis methods. And the reason that's good is that you don't need IRB approval. You can learn a whole lot by reviewing systematically the literature and answering a question, and it's a doable kind of project for the amount of time that you have. Some examples from our own students. One of our students looked at the question of whether ultrafast brain MRI reduces radiation exposure in children who have shunted hydrocephalus. She basically quantified the radiation exposure from a CAT scan before and after a new standard of care protocol was implemented in our hospital. And she compared whether there was less radiation afterwards than compared to before. A second student looked at women undergoing treatment for endometrial cancer and examined the complication rates and the associated costs and whether those differed for those treated with minimally invasive versus open surgery. So you might imagine that complication rates would be greater for people who had open surgery compared to minimally invasive surgery, but that was a question that she wanted to answer, and she did a complicated statistical analysis of a national data set that's publicly available in the United States that looks at procedures and cost of procedures. And she got an oral presentation at our Medical Student Research Day. So, moving to history, ethics, and the art of medicine. The possible content areas that people have worked on in this concentration are the history of medicine, ethics, patient-physician relationship, communication, and medical education. The methodologies that you could use to approach these topics are to do a conceptual analysis, which would result in an analytic paper or a review paper, an empirical analysis, which basically just means data collection and analysis, which is what we typically think of as research, but there are other kinds of research. So this is called an empirical project. And that could be either quantitative, qualitative, or used both qualitative and quantitative methods, which we call mixed methods. And during your next module, we're going to talk more about qualitative and quantitative work. It could be artistic or creative. There are students who have written short stories, done plays, poetry, visual arts, or film. So this concentration provides an opportunity to conduct a scholarly project that focuses on the moral and humanistic dimensions of medicine, and hear the voices and honor the values, perspectives, and experience of all people involved, including patients, families, practicing clinicians, clinician researchers, clinician educators, and medical students. Some examples of things that students have done. There's a student we had who did a project about ethical reasoning and error disclosure. So in the United States, there is a big push for physicians to disclose or tell patients when a mistake has been made in their care. And that is a difficult thing for a lot of doctors to do. When that happens, it's really upsetting. And so this student looked at standardizing a measure of how other students are reasoning through ethical dilemmas, and then their attitudes towards disclosing when an error has occurred. Another student of ours did an ethical analysis of parental consent regulations for pediatric HIV testing in the Côte d'Ivoire. That was a conceptual paper where she basically took an issue that was an ethically important issue, and she looked at all the pros and cons of different possible consent regulations and the particular consent regulation that was present in the Côte d'Ivoire where she was doing her project. Another student who worked in the humanities did a creative writing project. She looked at pre-medical experiences in satire, and she had a writing coach through a mentor who was an undergraduate English professor. We had a student do a project on substance abuse and the doctor-patient relationship. So she basically looked at people who had addiction disorders and how they felt about their relationship with their primary doctor, and what they felt they needed more support, how they felt they could be supported better by their doctors. And she published that study. That was a qualitative study. Another of our students did a project in medical education. Rhiannon looked at the experiences that first-year medical students have with doubt, basically meaning, do they feel like they were really cut out for a career in medicine? Are they overwhelmed by their courses? Are students, are they scared about going on the wards and interacting with patients? And looked at what it's like to experience doubt. And she published that paper and presented it at a national meeting here in the United States. In terms of history of medicine, we've had lots of students do interesting projects. Sarah Wallace, in one of our first cohorts, looked at global health in conflict and understanding the opposition to vitamin A supplementation in India. So her project basically looked at historical documents and tried to figure out why, after vitamin A was determined to be useful in preventing blindness, why there was still opposition in India in politics around vitamin A supplementation. And she basically went back and discovered the communications that happened between the investigators that discovered vitamin A and the policymakers at that time, and tried to analyze why there was some conflict over that issue, which would seemingly be a pretty straightforward thing. Other students have done analyses of illustrations in 13th and 14th century surgical manuscripts. And here's a picture of two of our history of medicine faculty with one of the students. Another student looked at the autopsy and the use of the autopsy in the 1918 influenza pandemic, and she won an award here at Johns Hopkins, and there's a picture of her with her mentors. The history of medicine people, as you can tell from the pictures, seem to have the best time, and they seem to always be drinking champagne. So I don't know if that influences your choice, but I think history of medicine looks like a fun concentration. Finally, we have public health and community service. There are also lots of different options in this concentration. So first, in order to sort of organize all the things that people do, take a look at the figure on the slide. So first, there are projects that we consider strictly research projects. You're just studying a problem that exists in public health. Maybe you're describing the epidemiology of the problem, or you're describing how a solution, a possible solution to fix a problem, and you're doing research around that. It could be that if you look a little further to your, I think, left, you're looking at a policy issue. You're going to analyze a public health policy issue. So, if there's a law passed or a policy passed in a local city, the city where you grew up, somewhere that you're just interested in, and you think that law is a good idea or a bad idea, you can analyze why or why not it would be a good idea. Then there's, on the other side, there's service, where students are allowed in our course to go and be part of a community service organization and do some reflection, some scholarly reflection around that participation. So if you go and provide healthcare to people who need it as part of a community organization, you can make that part of your scholarly concentrations. And then finally, there's educational topics in public health, where you design and evaluate an educational program. So, a couple examples of things that our students have done in public health research. There are two students that looked at some of the HIV risk factors in our Baltimore Latino population. So in our city here in Baltimore, there's a growing population of immigrants, and they have some risk for HIV that might be different than people who have lived in Baltimore for a long time, where most of our HIV is transmitted through needles and drug use. So these students got together and they worked with a faculty member to look at what are the risk factors for HIV in the Baltimore Latino population, and how does the population understand or think about risk for HIV, and what are their needs for educational interventions, if any at all. There's another student who did a cost-benefit analysis of a new TB test and tried to figure out whether the new test was better than the old test, was more cost-effective than the old test. There's a third student looked at follow-up to Pap smears in El Salvador, where there was a problem that Pap smears, if they were being done, didn't necessarily get followed up on. So women with abnormal Pap smears were not getting follow-up treatment. And so she did a research project focused on that topic. Another student looked at the association between what we call the safety culture, or the degree to which our health professionals will work together to reduce errors, and looked at that culture, how much the error reduction was valued, and how that related to whether there were adverse events in surgeries. And then a student in our first cohort, Alexander Harding, studied the effectiveness of lime juice and ultraviolet light to sterilize water. So I've spoken about this student's project before, but if you didn't hear it, basically Alex was sitting in class one day and found out that there's a substance, psoralen, within limes that can serve as a disinfectant, and thought about this public health issue, which is that people who don't have access to clean water will put water in a jug and do what they call solar disinfection. And so they basically put that jug of water under the sun, and you have to wait a certain amount of time for the water to be safe to drink. But because that process takes so long, sometimes people need water before it's complete, and so they'll drink the water. And so Alex wondered whether you could put lime juice in the water, and that would accelerate the disinfection of the water. And so he did a project where he basically filled up tubs of water, put some bacteria in them, and put lime juice in some and not in others, and then exposed them to UV light, basically by sitting them outside on our campus and monitoring them, and then look to see whether the lime juice reduced the amount of time that the water had to be sitting in the sun. In terms of health policy projects, we had two students who worked to create a nonprofit health insurance cooperative in Maryland. So Maryland is the state that we live in, and there was at the time no way for many people to get health insurance. And so they were trying to develop an early model for that wouldn't require a universal health coverage, but could create affordable health insurance for people who otherwise couldn't afford it. Then there is another student who looked at the effect of reimbursement on primary care physician participation in in the Medicaid program, which is the national health insurance program we have in the United States that covers people who can't pay for their own health care, who meet certain income levels. So if you're poor and you can't pay for your health insurance, you can get this national health insurance. And so but that national health insurance doesn't pay as much to the doctors as private insurance does. So this student was looking at whether the policies that Medicaid passed regarding how much the doctors would get paid affected whether the doctors would take that insurance, people with that insurance or not. And then finally, one of our students looked at the economic impact of early antiretroviral therapy on HIV treatment in India. In terms of community service, we had a student that went out to the Native American communities on reservations in the southwestern part of the United States, and went and just drove around and tried to promote access to nutritious foods for the children there. We have a second student who went to the Democratic Republic of Congo and tried to look at improving health and social services for survivors of sexual violence there. In public health education, we have a student who developed a prenatal curriculum for pregnant Latinas in Baltimore to educate and provide resources for those women to take good care of themselves during pregnancy and be prepared for childbirth. And another student who did an adolescent sexual education curriculum for students in Baltimore. So those are a lot of projects, ideas, a lot of thoughts for you to digest. Finally, just find something that you really enjoy doing and find someone that you really want to work with. And I'm happy to take questions.